Thank you very much, ma'am. This moment is of happiness to me. With profound respect to my guide, Professor Sanjeevi Thomas, and Madam Vengama, and all the people who are present here, who has responded to my invitation and be kind enough to be here in time and bear with me for 15 minutes for getting the stage ready. So, with all your permission, let me begin. This presentation. Certain abbreviations have been used in this presentation. As you see, women with epilepsy, women without epilepsy, anti-epileptic drugs, SIM for self-instructional module, CRK for child-rearing knowledge, CRP for child-rearing practice, VAS for visual analog scale, and MIS for maternal involvement scale. Yes. All of us know that epilepsy is a very old disease. You look into Vedic literature, it is there. You look into Hippocrates' writings, it is there. You look into the Bible, it is there. In our past history, world history or Indian history, if you search, there are people with epilepsy. In fact, Hippocrates wrote the first book on epilepsy. At that time, it was known as sacred disease. It is a disease which is misunderstood, feared, considered as a curse, or possession by evil spirit or demons, many a time concealed, and so led to some bias or social problems. It's a sudden, excessive, and rapid discharge of electricity by brain cell. This definition has been given by Jackson way back in 1873. To define, it's a heterogeneous condition characterized by recurrent seizure that are not provoked by a metabolic or toxic disturbance or by an acute central nervous system insult. And the famous medical journal Lancet says epilepsy is the most common neurological disorder in every country. Yes. Coming to the prevalence of epilepsy in India and Kerala, about 5 million people with epilepsy in India, with a prevalence rate of 5.59 per thousand, and about 50% are women. The crude point prevalence ratio is around 4.9 per thousand among the people of Kerala. When age adjusted or age standardized rate, it will be little less than this 4.7 per thousand, and 50% of them are in the reproductive age group of 20 to 50 age group. Yes, sir. Still, such an old disease affected everywhere, but still it has got poor knowledge and attitude towards this disease. Many knowledge attitude practice studies, they found that knowledge about and attitude towards epilepsy is very poor. Whether the study is done in Seoul or the discrimination and the bias towards these people with epilepsy, it has been gradually given way to an atmosphere of acceptance that people with epilepsy or women with epilepsy, they are getting married, getting pregnant, and rearing their children. Coming to women with epilepsy, prevalence of and treatment for epilepsy, they are similar among men and women. Then why women with epilepsy is so special? Because women with epilepsy, they face gender-related issues, especially during reproductive years, including change in seizure frequency. Certain issues are hormone effects on seizures, effect of epilepsy on pregnancy, teratogenicity of anti-epileptic drugs, contraceptive pills and anti-epileptic drug interaction, breastfeeding issues, and effect of epilepsy on sexuality, fertility, and even body health. These women issues in epilepsy, all these issues are understudied. Problems of women with epilepsy related to childbearing, they have not been studied well. Lack of knowledge and unwanted fear which exists among women with epilepsy, their relatives, and even healthcare personnel. Coming to pregnancy in women with epilepsy. Brown et al. Says it is the most common neurological disorder during pregnancy. And it is a challenge, it's a medical challenge to the physician who is treating, to the neurologist, it's a social challenge, and the women with epilepsy, they face a lot of psychological problems including depression. Coming to epilepsy and pregnancy. Most women with epilepsy, they can conceive and bear pregnant children. And proper planning, it can optimize the health of women with epilepsy during pregnancy and reduce the risk to their babies. Coming to childbearing, What is child rearing? It is the bringing up of children by parents or parent substitute. And major child rearing activities during early infancy. It's a blend of many maternal activities. Next one. As you can see here, it includes feeding, whether it is breastfeeding or complementary feeding, monitoring the growth and development, protection, that is protection from infection, injuries, accidents, etc., and providing appropriate infant stimulation. Next one. Women with epilepsy and child rearing. These women, they have very various concerns about child rearing practices, and they lack self-confidence in bringing up their children. Women with epilepsy, they seem to have poor child rearing knowledge and child rearing practice, leading to problems to themselves as well as to their babies. Next one. They face bidirectional problems. Next one. Like an increased demand of taking care of the babies. It has an adverse effect on epilepsy. And epilepsy and anti-epileptic drugs, on the other hand, it alters the mother's interaction with the child. Maybe she will be sleepy, she will be under the effect of anti-epileptic drugs, or she can have seizures. And this lacunae in good child rearing practices, it leads to a delay in initiating and sustaining breastfeeding, inadequate infant stimulation and protection, and sometimes groping of babies. And as I said earlier, it's an understudied area. Doubts regarding the ability of women with epilepsy in child rearing, it still persists. And child rearing knowledge and practices of mothers with epilepsy, it appears to be unsatisfactory. And these women, they were not adequately informed about the impact of epilepsy and anti-epileptic drug therapy. In a recent UK study, it is found that 50% of mothers, they were informed about caring and managing risk. That means the rest 50% they were not aware of. In a developed country like UK, and the study is very recent also, a positive correlation was observed between child rearing knowledge and practice. The maternal knowledge, it has been found that self-instruction module as an effective teaching strategy. Maternal knowledge to child rearing, it appears to increase the appropriate certification. Many authors have brought out this fact, and several nursing studies, it has shown that self-instruction module as an effective teaching strategy. Now coming to problems of child rearing among women with epilepsy. Backshaw et al. Recently they found that the most problematic area for women with epilepsy while caring for their babies, they are caring for the baby outside the home and waiting the baby. With all these backgrounds, we have selected problem area of child rearing practices and health-related problems of women with epilepsy. What is the effect of a self-instruction module? The objectives of this study. It is done in 2 parts. Part 1, the objectives are to compare the knowledge and practice of child rearing among women with epilepsy with that of women without epilepsy. Number 2, to compare the maternal and baby outcome among women with epilepsy and women without epilepsy. To identify the possible predicates which influence the child rearing practice and baby outcome. Why this has been done? Because there was no yardstick against which the child rearing practices of women with epilepsy could be compared. Next one. And after that, part 2, that is to determine the effect of a self-instructional module on knowledge and practice of child rearing among women with epilepsy. Now, what are the, how I have defined the terms. Child rearing practices, what I meant is, these are the self-reported behavior of the mother in caring her baby during early infancy. It includes items from the core domains of child rearing, namely feeding, monitoring growth and development, cleaning and protection and prevention of injury, infant stimulation, and it is measured with the help of a child rearing practice scale. And child rearing knowledge test items, they are prepared on these core domains. Next one.